Opioids. What are the three most common mistakes you see when it comes to opioid use in anesthesia?
The three most common mistakes with opioid and veterinary anesthesia. So, one is not using it preemptively, not administering the appropriate opioid for the surgical procedure prior to when the blade essentially cuts skin. Two, underdosing. People will tend to underdose opioids because they fear some of the side effects. So, whether that's vomiting or excessive sedation, and then they can also worry about a prolonged recovery. The other one would be ignoring like species differences. People will just maybe blanket administer opioids regardless of it being a dog or a cat. So with cats, you can appreciate hyperthermia at times with opioids. And so you may find that your patient can become very hyperthermic after anesthesia. Whereas in dogs, you find hyperthermia to be less common or really not a side effect. If you administer, let's say, hydromorphone to one of your patients and they pant, then they can get hyperthermic from that. So just making sure to monitor them. Another one is opioids tend to cause vomiting a lot more in your dog patients, but it also depends on the opioid. So hydromorphone, morphine are more likely to make your animal vomit compared to methadone, but it also can depend on how you administer it. So if you administer hydromorphone IV, they're a little less likely to vomit in comparison to it being IM. So ideally, when you pre-med your patient, you should always include an opioid as part of your pre-med and not administer it in the recovery or during right before you cut because you need to give it time to work. So fentanyl has a much shorter onset, but it also has a shorter duration of action than in comparison to, let's say, buprenorphine, where it doesn't matter how you administer buprenorphine, meaning IV or IM, it's still going to take about 20 to 30 minutes to work.
What about the underdosing? Is it just people afraid of the side effects mostly?
I think some of it is they're afraid of the side effects, going back to the hyperthermia, or they're worried about excessive sedation, as some opioids are more sedating than others. And so people will underdose it in the hopes that, they can have faster recoveries.
So how come you are not afraid of overdosing? That maybe a vet who is a bit of afraid of the side effects. Like, what can you say to them to, I guess, ease them of their worries?
So I just think reviewing your literature, knowing the dosing, and you can always start at the lower end of the dose and then just making sure to properly monitor your patients. And then I also will combine it with either some type of sedative or anxiolytic, whether that's dexmedetomidine or acepromazine. So I can stay on the lower dosing range of my opioid and not see maybe such prolonged recoveries.